Hello, I am Muskan Yadav, an aspiring nutritionist. I am happy to have been serve you the benefit of plant-based diet. Today I am with three amazing nutritionists and I am glad to introduce them to you. Our first panelist, Ms. Reha Ranglani, is an integrative nutritionist and a health coach practicing for the last 14 years and has helped 20,000 plus people across the globe to become a health independent and the charge of their own health. She believes our body has this innate ability to heal itself, provided it's fed with the right raw material in terms of food, thought, emotions, and actions. She helps people reverse or manage obesity, diabetes, thyroid, PCOS, infertility, and any other issues in most natural way possible. Our second panelist, Ms. Kajal Bhatia, has spent 15 years of her life practicing plant-based nutrition. With a post-graduation in diabetes education, Kajal has also reversed lifestyle disorders for many. She is instrumental in licensing a plant-based academy along with Ila Pathak with an accredited nutrition college in India. She has also consulted at BCG, Dun& Bradstreet, Google, and Raw Presseries. Ms. Kajal also runs a 100% plant-based lifestyle brand called Plant Power. And our third panelist, Ms. Ila Pathak, is a certified nutritionist and holds a master degree in nutrition. She is an active proponent of plant-based lifestyle. Ms. Ila has coordinated and conducted signature cooking demos. Along with Kajal Bhatia, she has helped, curated, and coordinated a plant-based certification course. Along with being a speaker at the course, Ila has been practicing plant-based nutrition for the last 55 years. So let's move to our question. My first question is for Miss Neha.
Hi.
Miss Neha, hello.
Yes, yes.
So my first question for you. Today we have seen a trend where the girls are getting period at 8 to 10. What's your take on it? And what are the repercussions these girls have to face in later life?
So, well, today I think the entire lifestyle has changed so much from what it used to be, for us, for our mothers, for our grandmothers. I think the entire way of living and being has changed for girls. And um, the kids today, the girls today are more obese than we used to be at our time, and we saw obesity rates at our time were lesser. But the girls today are obese. They may look thin, they may look slim, but they have higher fat percentages, and because of that, what happens is your body produces more estrogen because your fat as a tissue also produces estrogen, the hormone estrogen. And the more estrogen and the higher quantity of it, and the faster that the girls produce that, the faster the chances that they go into menstruation, or they reach menarche. So that's why we are seeing a lot of early menstruation cases in girls today. Also, another thing that's happening is um, there's a lot of exposure to toxins around us. So from your food to your water to your air, besides that, to the products that you use on your body, from the makeup to the just your creams and body washes and everything, the detergents, everything is loaded with a lot of chemicals. Also plastic bottles, eating in a lot of plastics, drinking water out of plastics, all of that leads to exposure to toxins, which are xenoestrogens, which are hormone disruptors. And these behave like estrogen in the body, and they create havoc and hormonal imbalance, because of which, again, the girls are getting into periods faster. So the cutoff age should be 12. So earlier, women would get periods between 12 and 15, but now they're getting periods before 12, also as early as 8 and 9 and 10. So that, I think, is a trend that we are seeing today, and it's more to do with the obesity and the toxins majorly. What are the repercussions of this kind of early menarche on girls later is there are higher chances of them getting into mental disorders like depression, anxiety. Studies have shown that there's higher chances of them being obese, developing diabetes, cardiovascular disorders, and maybe early menopause as well. So all these issues is something that women can face once they get into periods faster. Bone density starts going down later in the age, in their later age, and In general, the quality of life for a woman reduces when she gets into periods faster. The height of the girl also stops increasing because, all your skeletal plates stop fusing together when you get into your periods of puberty faster. So all these changes is something that you'll see in girls when they get into periods earlier. Yeah.
Thank you, Ms. Neha, for this lovely answer. Okay, so move on to our second answer question. Uh, for Ms. Kajal, is there a paradigm shift in the menarche and menopause ages? What could be the possible reasons? Ms. Kajal, am I audible?
Yes, yes. Sorry, I was on mute. Great question, Muskan. I congratulate you as well as because this is the first time you're on a platform and you're an aspiring nutritionist. You're keen to learn everything out there. But 15 years, what I've studied, very difficult to put it in a capsule. I'll try my best. Yes, there has been a paradigm shift. Neha has already caught on to that fact and shared it. But I also want to talk about menopause because both menarche and menopause, menstruation and menopause, there have been these median ages and everything shifting around those ages, especially in this particular generation that we see, whether it is teens who are getting into menarche or they are postmenopausal or perimenopausal women experiencing that at a stage of life. Now, these both are very, very important productive years, as I would say, for women. They almost are known as the alpha and the omega. And they are important because they essentially affect ovarian function and they also affect aging. Significantly, a lot of research has come up where either early or late menstruation or menopause is causing significant physiological changes as related to aging as well. A lot of studies have come out, and I have studied the issues, related to the risk factors concerning early menarche and early in menopause. Is it correlated? Why is it so important to understand this? Because the risk factors associated with both have high consequences, both in terms of early menarche and late menarche, both in terms of early menopause and late menopause. Just to say a few, there's even studies as significant as premature death, which I've come across, breast and endometrial cancers, there's depression, cardiovascular disease, obesity and cardio and metabolic syndrome functions. There's early initiation also of smoking. 6 studies that I found on it. There's early first sexual intercourse. Of course, the complications related to teenage pregnancy, one can't deny, as well as about late menarche, the depression and the lower bone mineral density. A huge amount of studies by our contemporaries that are even currently going on. As far as menopause is concerned, the early stages, again, the risk factors, cardiovascular and coronary diseases, lower bone density, osteoporosis, premature death again, late menopause, again causing breast and endometrial cancers, longer life expectancy issues. So one is not actually getting away from making anything later. Okay, yes, early has been more significant in terms of risks, but even later to undergo these experiences is causing outcomes that are dangerous. So the correlation between the two, I have studied extensively on it, and I have only found one study by Sains in 1918, as early as 1918, which indicates that yes, there is a correlation between one setting into an early period and then one consequently also setting into early menopause. But when I have seen, when we sit with patients at our clinic, it is very visible to know that yes, early menarche, when we ask women, and teens, the age, the maternal age at which their moms could have had this situation in their lives, which could give us some predictive analogy on how they could face it and what year they could face it. It is very easy to predict based on the maternal menarche age. But as far as menopause is concerned, whatever we have seen in our research and whatever we experiencing along with our contemporaries who are practicing this, whether it is whole food plant-based, whether it is not, but mainly whole food plant-based, we are seeing that, and there's obviously limited data in that, but what we are seeing is it is very difficult to predict menopause at a later stage for women, because when we ask about the maternal, that is the mom's age for them, it has been seen that it is mainly the lifestyle factors, a larger history for menopausal women than menarche, a larger history on that as to mainly lifestyle factors that is causing early or late menopause. So the correlation between the two, the association between the two, which I wanted to talk about, definitely a big issue. And why is it so? Hormonal changes with both birth weight of the mom. At the time the birth weight of the mom, the birth weight of the child at the time you're born, things as gestational diabetes, which happens to the mother when the child is born, and then she suffers early menarche, breastfeeding issues, stress, and obviously follicular atresia, which is basically a degeneration of follicles. I would like to cut it short right now. I've left a lot of pointers here, but happy to talk about it much later in a probably a longer session. Thank you, Muskan.
Muskan, I would like to intervene here. Neha, I would want to know your take on the hormonal issues such as PCOS. Since we are on this topic of menarche, I would want Neha's take on the hormonal issues that the young girls are facing these days.
Right. So I think when I was studying nutrition and when we were in the early years, PCOS was hardly even a problem. Like, our college didn't pay so much attention in teaching us what PCOS was because it was so new and, people were just like, okay, we're not getting their periods. And I think it's taken so many years for people to understand and for studies and for research to happen to understand what is exactly PCOS. For the longest time, people didn't know how to even define PCOS, right? I think initially it was a hormonal disorder. Now it's a metabolic disorder. Everyone's got to know that. And period issues. So what happens is I'm literally seeing 8 out of 10 girls that I see in my day-to-day practice that they have some or the other hormonal issues. So either it's PCOS or they'll have heavy periods or scanty periods, or they'll probably have, just irregular periods without PCOS, high prolactin levels that are, it's seen in women as young as 17 and 18. So I think that is a real big concern because it's majorly to do with the lifestyle we are leading today. So the PCOS, which is, of course, the typical hormones, the typical symptoms are hormonal because you don't get your periods and you have acne and hirsutism, but it is a metabolic disorder. It affects every organ of your body, from your gut to your liver, or rather, your poor gut affects your hormones. So it's basically like a two-way street. Both of them are, rubbing on each other, and it's affecting your overall health, your overall metabolic health. And along with that, you see women going through low confidence, depression because of the way they look, because of their way their body is, not getting periods. They feel bloated. They feel completely out of shape. And I think most of it is to do with, again, what I've seen in research is what new researchers say is that PCOS starts as early as in womb, the mother's womb, because when the mother is exposed to so many toxins, and when the mother is going through maybe emotional trauma or any kind of setback in her life, all those factors affect the girl child in the womb. And it increases her chances of getting hormonal issues and PCOS later in life. Of course, because the lifestyle of the child and the mother being the same, the food that the mother eats, the family setup is the same. Though, I mean, now she's got the genetic factors of getting the hormonal issues, but the lifestyle factors are the same. She eats the same food that the mother eats. They're exposed to the same toxins that the mother is exposed to. So I think it's more to do with the lifestyle, the way the girls are living today, with the kind of stress even the young girls are having today. Stress is one of the major factors which affects your hormones. So A, that. B, insulin resistance is so big thanks to all the sugar, high fat foods that the kids are consuming. processed foods, a basic breakfast of a normal child who goes to school or college is cereals and milk. And I think both of these factors play a very important role. Dairy, again, another thing which is so much consumption of dairy in so many ways. Your cheese, butter, paneer, ghee, all of that is happening. Also, um, lack of sleep. I think that's another factor which is so important that people don't realize. Kids today are up watching Netflix, not prioritizing their sleep. They want to watch another episode and they want to binge watch, and then they sleep late, wake up late, and then they feel, okay, we've covered our 7 hours of sleep. But that's not right because the circadian rhythm is off. You know, women, I mean, your body works with the sun and moon cycle. So if you're literally sleeping in the midnight, your body's not going to repair and recover. Your liver's not going to detoxify. Your gut, your microbiome is not going to do what it has to do. It's not going to heal. It's not going to get better. So I think all these factors eventually lead to hormonal imbalances. And these, for some women, obviously, depending on the genetics, depending on the severity of the lifestyle factors and the intensity of these factors, women have PCOS and then they have other menstrual issues. So I think it's a sad plight, but I've also seen once you start reversing and you start correcting these factors. So for every person, the factor is different, right? So for every girl who's coming with a hormonal issue, the factors are different. More or less they are similar, but the intensity and the severity of each factor can be different. For some, it could be just the off circadian rhythm. For some, it could be too much stress. So we need to really understand what's in play over there and then work on correcting that, and then from there improve their hormones. And it all gets better. It gets reversed. They live a healthy life. They conceive. I think all of that I've seen in my whatever 14 years of practice, and I think it's amazing to see that.
Great. Thanks, Neha.
So my question is for you, Ila ma'am. What dietary approach to naturally treat menopause symptoms?
Thanks, Muskan. Yeah. As important as menarche is in a girl's life, menopause is also equally important and dreaded amongst many women. Why is it so? Because it comes with a plethora of symptoms like night sweats or hot flashes, vaginal dryness, difficulty in sleeping, or it can have adverse effects on the moods and sometimes cause a full-blown depression also. So, what can actually be done to tone down the severity of these symptoms? What studies have shown is that the number one aggravator of these menopausal symptoms is oxidative stress, which is actually a consequence of an abundance of oxygen free radicals. How do they actually how does this happen? Because our antioxidant defense of the body has reduced. Okay, so what is the solution? Number one solution is having a diet rich in antioxidant fruits and vegetables, which can actually counter the effect of these oxygen free radicals on the whatever functional ovaries a woman still has, if at all, during menopause. Okay, so a pro-inflammatory diet which is high in meat, dairy, is definitely going to aggravate the menopausal symptoms. Okay. I would especially like to mention dairy here. Why? Because we all know that a mammal lactates when it gives birth. So imagine the amount of hormones in a cow or a buffalo when it is lactating. And with the animal farming happening these days, it may so happen that the animal is pregnant as well as lactating at the same time. So the amount of estrogen in its bloodstream is at the peak. And when we drink dairy or eat dairy products, all those bovine hormones enter our system and they mess up with the human hormonal system. So this is another major aggravator. If at all you want to drink milk, any plant-based milk, in fact, soy milk seems to help. When put to test, women randomized to drink soy milk have in fact reduced their menstrual symptoms by 20% in 12 weeks. Okay. The second, over the last 2 decades, there has been evidence to show that food derived advanced glycation end products, which are also known as AGEs or glycotoxins, uh, have been shown to contribute to oxidative stress. How do we get those AGEs? They are basically uh, from animal derived foods. And second is the way we cook our foods. So, broiling or frying or stewing will definitely increase the AGEs in the food. So a boiled chicken will definitely have less AGEs than a probably fried chicken. But a fried potato will have lesser AGEs than even a boiled chicken. So my point is, first, it depends on the type of food, kind of food you are eating, and second, the way it is cooked. So shifting from a high temperature dry heating to a low temperature and more humid way of cooking will definitely reduce the AGEs in the food. Smoking also, those women who smoke, they are very, very susceptible to getting the glycotoxins from the smoke. Okay, so that is a strict no-no. Then I'm not an Ayurvedic doctor, but trials have shown that roots of licorice, mulethi as we call in Hindi, they are known to reduce the severity of hot flashes. So, of course, a woman will definitely have some of the other symptoms, but they should try to uh, reduce or tone down the severity by whatever I have mentioned just now. Thank you.
Thank you, Ms. Hila. So move on to our next question for Ms. Kajal. According to you, please elaborate on the significance of bones and muscles health with menopause.
So thank you for that question, Muskan. It has such a significant health of course, bone, as most of us know, because menopause and osteopenia, osteoporosis, osteoarthritis have been talked about for decades together, and most of us have felt those symptoms as we hear our family members talking around us. But more importantly, and I do want to elaborate on the muscle part of it, because that is something that is completely ignored, whether in academic discussions or even at home. Yes, bone health is something that is almost parallel to perimenopause, menopause, and postmenopause. In fact, there is a significant loss even between perimenopause and postmenopause, almost 20% reduction in in bone mass. And that is purely because of the osteoclast, the bone building cells, which are prevented due to the increased, activity in the hormonal system, and of course, reduced estrogen. That is setting the trend for the bone health, right? And definitely, lifestyle changes, as suggested, will come up when Ila shares it. But as far as muscle health, why is it so important? Simply because muscles, in a way, are life. That is the only way that the body gets strength. It is literally, as we speak, the axis on which the entire body is standing. And it is very easy to know that as one grows older in life, the biggest thing that when one checks out is the degeneration of the complete muscle fiber that is noticed in aging. What menopause does is it actually accelerates this aging process of the muscle. Why is that so? Because we don't look at it. It is none of our concern, and we've completely avoided it as something that is a trigger point for us, especially to take care of during menopause. It was interesting for me to see that, you know, when we talk about muscle health, it doesn't simply mean, you know, building muscle mass, as we say, or having reduced fat, but it actually also means increase in muscle function, because that is something that is again deteriorating along with menopause, as we say. In fact, it has been seen in studies that the adverse risks of menopause are closely interrelated with aging. You know, and aging, and that includes loss of muscle function in every possible manner. There have been so many studies that have come out related to that, because the body becomes vulnerable to this loss of muscle mass. And in fact, there was a recent study that has come up with the American Heart Association, because even the heart is a muscle, and one should look at it also like that, to keep it strong, to keep the endurance, the stamina, and the fitness of the heart as a muscle. It is important that activities related to strength, whether it is just picking up two shopping bags, fruit bags, you know, at your own home, or in some way increasing strength in the body. The Heart Association recently, you know, shared that high muscle mass, people with high muscle mass levels are likely to live longer in spite of going through menopause, especially women. When it's very important to talk about women and cardiovascular strength, because one of the biggest risk factors that we see as of today, and I see them a lot at my clinic, is this rapid increase in heart failures for women. And like I said, it's very correlated that strength for the overall body, including the heart muscle, becomes important. And of course, you know, when I speak to many doctors, you know, my contemporaries, even people who are experts in cardiovascular fitness, you know, they emphasize and they insist, and I believe so, that we all are looking at weight loss as a women community together, you know, and of course that's important. But also during menopause, it's pretty critical to look at strength and building that strength in many ways possible. Even talking about urinary incontinence, Ira, which is a factor that is a symptom that you know, you would refer to when it's menopause. Even for the urinary system, you know, Kegel exercises, the strength building related to that is often spoken about. Now, even dilation and contraction of that muscle itself, you know, if it's addressed, that becomes important as we go into the aging years. This is true definitely for women as far as heart is concerned, for both men and women, because somehow we've I think in this session we are not going to be talking about andropause, which is male menopause, but yes, overall strength for the body and overall strength through the muscle mass is pretty critical when it comes to postmenopausal. In fact, all the way post 35 years, because that's when muscles start degenerating when you don't use them. I hope that answers your question.
So, Ms. Kajal, according to you, please elaborate on the significance of bone and muscle health with menopause.
Great question, Muskan. Definitely, bone health is a discussion that's been never ending, and over time, one has significantly talked about it. It is related to osteopenia, significantly osteoporosis, and osteoarthritis as well for women, and definitely due to the increase in estrogen for the body, which plays a role in the osteoclast and the osteoblast cells, which affect bone formation. It is important to look at that. But also a lot of studies and a lot of clients, when they come to the clinic with menopause issues, we often see that there is a complete degeneration of the muscle. In fact, there's a lot of muscle wasting. Not all are sarcopenic. Sarcopenia is actually a muscle related degeneration disorder, but definitely there are pretty significant symptoms related to that, and to the fact that it's almost like menopause becoming a silent disease, percolating into complete degeneration of strength. Now, it is important to talk about muscle strength because that is largely ignored. In fact, muscle is one of the biggest factors giving both strength and energy to the body. As we see around, in life and even in our own homes, families, where this is completely ignored, one sees that when one checks out in life, the biggest factor that is visible is complete breakdown of muscle and a lot of muscle wasting. Interestingly, with sarcopenia, which is age-related muscle wasting, there is not only muscle wasting, which is a problem, but there is also muscle function. Now, the ability to do your routine activities, be independent on your own 2 feet, in spite of being a menopausal woman, taking care of, your surroundings and yourself, it requires to be standing on your own 2 feet and at least making sure those skills are, enabled, and they are inherently there with you. However, this breakdown affects the quality of life as one ages, and of course the age factor as well, because studies again coming up showing a strong correlation between muscle health and aging. And that means significantly that one doesn't only need to look at taking in a lot of things related to bone, but also addressing muscle, whether it means simply picking up shopping bags with fruits in it, or many other lifestyle changes that that can help you build muscle. In fact, when I've spoken to contemporaries and also, many doctors, fitness experts, all in this phase of study related to menopausal women, it is significantly noticed and shared that, yes, look at weight loss, you look at a good muscle, lean body mass, but at the same time make sure that you are focusing not only at weight loss but also on building strength, which becomes more and more significant, of course, at menopause and post-menopause, but also throughout life. So that is something that I'd like to leave you with. Thank you.
Thank you. Thank you so much for this lovely answer, ma'am. My next question is for Miss Ela. Are menopausal women more susceptible to developing cancer? If yes, why it is so?
Thanks, Muskan. Yes, definitely. Menopausal women are more susceptible to getting cancer, and definitely something can be done about it. Why is it so? Because as menopause hits, the ovaries shut down and the estrogen level drops to 95%. It is, in fact, a good news for the endometrium, which is the lining of the uterus, because constant signaling of the estrogen actually increases the risk of the endometrial cancer. And relatively low levels of estrogen in the blood actually reduces the risk of developing breast cancer. But in many postmenopausal women, this there is relatively high levels of estrogen in the blood, which actually increases their risk of developing breast cancer. Now, why does the estrogen level drop to 95% and not completely to zero? This is because, as Neha rightly mentioned, some tissues in the body, that is the fat cells in the body, also manufacture estrogen, and hence the overweight or the obese postmenopausal women are more susceptible to developing uh, breast cancer or any other cancer. So it is actually a double-edged sword. We want the estrogen levels in the blood to come down, but as the estrogen levels drop, the menopausal symptoms aggravate. So we actually need to balance our hormones. There are various therapies available like estrogen therapy, which actually reduces the menopausal symptoms, but the downside is that it may not only lead to uterine cancer, but clots, stroke, heart disease, and dementia also. Okay, so we actually need to do something else to balance our hormones. What actually happens is women actually keep recycling their hormones. So if there is not enough fiber in the diet, this thing happens. There is a study at Tufts which says that estrogen, uh, fiber reduces estrogens, and fat actually increases estrogen. So if there is fiber in the diet, the excess of estrogen, which is produced by the liver and through the bile duct, it comes into the intestine. There, if it finds fiber, it attaches it, the excess of estrogen attaches itself to the fiber and is actually literally flushed out of the system. But if there is no fiber in the intestinal system, then it is reabsorbed. Estrogen is reabsorbed, and the excess estrogen keeps recycling. Hence, a woman needs to have sufficient fiber in the diet, okay, to actually get rid of the excess estrogen in the body. Then second is phytoestrogens. I'm again coming to soy, which is a topic on which Kajal will be actually talking about later. Phytoestrogens actually block the production of estrogen in the body, and they also cut the chances of a woman developing cancer later. Okay, then the third superfood is flaxseed, which has been used since Roman times. Even it was the first medicine used by Hippocrates, and it is a wonderful food in itself, coming with a strong hull, and it is packed with nutrients, which the hull helps to keep it fresh for a very long time. But then it can come out of the system if it is not if it is not chewed properly. So better to eat flax seeds in the ground form, and 1 tablespoon of ground flax seeds can actually effectively dampen the effects of estrogen, and uh, it increases the a woman's menstrual cycle by a day, not the menses itself, but the average cycle. That means you get fewer number of cycles in a year, which means lesser estrogen signaling and lowering the risk of cancer. Okay.
Thank you.
Yeah. One more point.
Okay.
The isoflavones, which are found in the soybeans, they are actually converted by a specific type of gut bacteria into a very, very useful compound called equal. And some people have that specific kind of bacteria in their gut and are able to produce this equal. So there are equal producing and equal non-producing people. Hence, this is the reason why some people are more benefited from soy than others. But soy definitely helps in reducing the risk of developing any kind of cancer in menopausal women. Thank you.
Thank you. So, Miss Neha, your thought on what are the top 5 numbers to improve hormonal health?
Top five no-nos. Yeah. Okay. So again, what I have seen in my practice, what really works is eliminating things which are damaging your hormonal health and which are causing a dysbiosis in your gut, which are affecting your liver. Once these three things are taken care of, in a lot of ways, your hormones start coming back to normal levels, right? So I think the first one is definitely dairy. So Ela, like she rightly mentioned, it has hormones, it has toxins, it has growth hormones. Also, your dairy has IGF-1, which is insulin growth factor 1, which is which mimics insulin. And already with PCOS and obese women, the insulin levels are high, insulin resistance is high. We don't want more of it, right? So dairy is definitely one thing. So dairy-free alternatives are a better choice to go for. The next thing that I have seen that works very well is eliminating the modern gluten. So the wheat today is very, very high in hybrid uh, forms of protein, which is gluten, and different types of protein which our gut really doesn't know how to digest. And these proteins actually start damaging our gut lining, causing leaky gut, IBS, and all of that, which again start affecting our gut microbiome and our hormonal health. The third thing is refined oils. So most people use oil very, very liberally and don't understand that to make about 1 tablespoon of oil, you need 1 cup of peanuts. Now you cannot eat 1 cup of peanuts, but they use oil like it's water. So I think that is something that as a practice needs to be completely controlled, because you need to be very sure of the amount of oil you're putting, because all the excess oil starts again making your liver sluggish. It affects um, your cell membrane lining, all the excess fat. It increases triglycerides. We don't want that to happen. So that's why it's very important to reduce your refined oil intake. And if you have to use oil, you can use a little bit of cold pressed oil. So all your kachi ghani oils and your cold pressed groundnut, coconut, sesame, sunflower, all of that is absolutely okay, because these don't have chemicals. Plus they have the nutrients of the seed that you're literally extracting the oil from, whereas the refined ones are chemically processed and they're completely devoid of nutrients. And the fourth one will be everything refined apart from oil, which is your sugar, your maida. Again, these foods, a lot of chemicals, no fiber, literally create a havoc with your blood sugar levels, increase your insulin resistance, increase your chances of fatty liver, and we know and increase inflammation again. So we know inflammation and insulin resistance are two major things for hormonal imbalances. So keeping away everything refined and going for more wholesome stuff. So your brown rice, or you could do jaggery, coconut sugar, a little bit of that. You could do whole grains, millet, especially your jawar, ragi. In winters now, bajra, makai. All these things are really, really great addition to a person's diet with hormonal imbalances. And the fourth one will be anything that contains toxins. You have to be very wary of what you're using, not only in your food, but on your body as well. Even your, simple things as air fresheners, your scented candles, your incense sticks, all of these have a lot of chemicals today. And these chemicals we are directly ingesting. Then your beauty products, everything that you're putting on your body, from your lipstick to your sunscreens, to your creams, to your body lotions, everything has very, very high amount of chemicals which really affect our hormonal health, and it gets into our liver, and liver has to process. But if your liver is sluggish, it cannot detoxify those chemicals, and then they start circulating in your blood, and then they start affecting your hormone receptors, and from there your hormonal health. So it's very important to choose toxin free products, from your shampoos to your conditioners to your body washes, as simple as your toothpaste. So very cautious, and check out the label and what toxins are there. There are a lot of websites which talk about the toxins which are bad for hormonal health, so you can check out those websites. There is I think there's a website called I'm not remembering the name, but I think it is environmental toxins something.org. I'm not sure, but you can check it up on Google and it will tell you what toxins affect your hormones, and you can actually avoid those toxins in these products. And yeah, these are the 5 things which are complete no-nos for people with hormonal imbalances.
Thank you, Ms. Neha.
Thank you,
So,
Muskan.
Ms. Kajal, your take on soya today?
God, that's a loaded question. Very controversial still, Muskan. When I was studying 20 years ago as a nutritionist, and I remember this question come up, and still the answers are going to be different depending on various advocates and experts. Of course, I would like to go with data that's coming out over time, and that has changed a lot. Yes, soya was controversial then. I do recall it very significantly, especially related to the anatomy of male, and even of it having damaging factors for women. However, it has been noted, and it is a double-edged sword. I won't deny it, but of course, all the non-GMO and all those labeling things put out of the way, the fact that soy does also have protective effects, especially for postmenopausal women. The whole biochemistry of it, right? I mean, when soy is actually, being ingested into the body, it is taken in by different kind of receptors. Okay, and because of the phytoestrogens in soy, which is the good estrogen for the body, that gets attached to the beta receptors. Okay, and yes, there is also soy which gets attached to the alpha receptors, but in case of soy which gets attached to the beta receptors, and which it usually does, this is definitely more protective and not as inflammatory, because it is actually the beta receptors are placed in the bone. Now that is the area where most activity is undergoing related to menopause, right? And that is where soil function becomes significant. Of course, not denying that if one looks very, very intricately, like a lot of my patients who are athletes, who are runners, when they're consuming soy, they want to get down to the very element of all complete amino acid profile, better than pea, better than other legumes that are out there in terms of complete protein. Yes, of course it is. But it's all about food combining and what does during the day. So I wouldn't say eat soy. That's the only plant protein that is there for you at every step in life. There are so many ways and delicious recipes by so many of us out there that significantly showcase ways to increase protein in the plant, right? Especially even for postmenopausal. From a protective viewpoint, soy, more than the other legumes and beans, has shown to be significantly working with menopause. In fact, there's a journal called the Menopause. One should read it, and there is a waves trial that had been published in the journal, which significantly talks about soy and also reducing the hot flashes for women, to the point of reducing it by 84%. Now, this was, a completely controlled trial, and just seeing that half a tablespoon of soybeans put into a soup or a salad, that reduces your chances of hot flushes, and that too by more than 50%. So that was great news to see. But of course, more and more such trials need to emerge in controlled environments. Very limited trials for the Indian subcontinent, I must say, and I've always been a little averse to just copying Western diets for the sake of it. It's nice to say avoid this, avoid that, or eat this and eat that, but locally, what is it that we are attuned to, right? Is soy a way of life for us? Not. But in today's day and age, when we are facing so many issues, like both Ela and Neha have mentioned beautifully, does an inclusion of that into the plan, especially for menopausal women, help? Yes, it does, and that's what recent data has shown. So I rest with that and pass on the mic.
Okay, thank you. So my next question is for Miss Ela. What lifestyle changes would you recommend it to the menopausal woman?
Yeah, good question, Muskan. Since we are calling it lifestyle changes, and what all we have been discussing till now comes under something called lifestyle disorders. So the solution is right there in front of us, staring at us, but somehow we are conditioned to think in a way that we are not able to see through those solutions. Okay. When we say lifestyle, it rests on 6 pillars actually. The first one is nutrition. The second is exercise. Third one is any material abuse like tobacco or drinking, alcohol drinking, stress management, sleep, and healthy relations. So these are the 6 pillars which actually one needs to strengthen to bring in those lifestyle changes. Okay, we have already spoken about nutrition, exercise. Yes, even if you are a menopausal woman, do continue with your exercise, because exercise definitely helps in the physical and the psychological aspect. Do bearing exercises like yoga or pilates, or just dance your way to glory. Okay, then is Stay away from tobacco and alcohol because there are glycotoxins, as I mentioned, in the smoke, which can actually mess up with the menopausal symptoms. Stress. Come on, woman. 50s is the now 50s is the new 40s, right? Even if you have reached menopause, uh, be like a free bird. Just don't think too much about it. This is where the life starts. Most of the women are empty nesters by that age, and it is the time when one can actually turn inwards, connect with the soul, and be happy, right? There are different ways to manage your stress, which everyone can figure out for herself. And the sleep, of course. Sleep is an issue when you are menopausal because if the menopausal symptoms are very aggravated, then sleep definitely becomes an issue. But we have talked about how to actually tone down the severity of those symptoms. And last but not the least is the social relations. Connect with your old friends with whom probably you did not have time to connect earlier. Travel and be happy. Okay. I would like to end my bit by quoting Donna Heifel, who is an author and a coach. She says the bravest thing in the world to do is to say something like menopause in the face and laugh at it. Thank you.
Thank you, Miss Ila. So move on to our last question for Miss Neha. What lifestyle changes do you recommend to young women to avoid hormonal issues?
I think more or less, I think Ela's covered all the lifestyle issues which we women, which in generally human beings face in life. And for young women, I think I want to definitely talk about three factors which are very important. One is movement. So, um, with the sitting culture that's coming today, I think women are not moving enough. So you can go to the gym for 1 hour, but that doesn't make up for the rest 23 hours that you are, just sitting or lazing or sleeping, right? So it's very important to consciously move your body. So taking movement breaks every 5 minutes, for 5 minutes, every 1 to 2 hours, getting up, moving around, doing your things. Maybe you have to take a flight of stairs or just anything that gets you to move. If nothing, just skip on in place or jog in place. Do some sort of movement, do some stretching, because that's very important for your body to keep circulating, for your lymphatic system to keep circulating. The next, I think, is very important is managing stress, because the amount of stress women are taking today is next level. And I'm not saying there is no stress. Stress is inevitable because it's a part of life. That is what life is. That's what we are here for as human beings or as spiritual beings in the human form. But we need to be aware of the stress that is there. So every change starts with awareness, right? So you need to first be aware that yes, I'm stressed out and it is affecting my health. And what am I really stressed out about? Is this thing worth being worked up about? Okay, it is. Is it in my control? No. If it's not, then there's no point of being stressed out. If it's in my control, yes, what can I do about it to change it or modify it or make it better? These are the questions you need to ask yourself. And then obviously certain doing certain stress relieving um, practices during your day. So making sure that you start your day with pranayams, meditation, you sleep, listening to some sort of calming meditation, because when you sleep, your subconscious mind is recording everything. And if you sleep in a stressed out state, you're waking up in a stressed out state, you're consciously in that cycle, right? So you need to break that with certain stress relieving techniques, and take breaks, walk in nature, meet a friend, listen to something. I think content consumption has become the most important thing today. Everyone is on their phone, so everyone is consuming content. So many people are looking at negative content. We don't even realize, because social media just shows us whatever it wants to show us. So you will see negative content, you will see a lot of hate, shame, a lot of violence. So avoid that kind of content. Listen to positive stuff. Listen to motivational, inspirational things which actually perk you up, which help you with hope and faith and just help you to move forward in life. And I think the last one is, um, please prioritize your sleep, because you don't know how underrated it is, but how important it is. You need to have a proper sleep hygiene, a sleep routine, a sleep schedule, regular sleeping patterns, because that's when the body exactly knows what it has to do, and that's when it does its best. So if you're not sleeping well, you are never going to recover from your hormonal imbalances. So I think for these young girls, these three factors are very important, because these three factors are predominant: lack of activity, lot of stress, and lack of sleep. So I think this is something that, yeah, I want to end with that. And also self-love, guys, very important. Please love yourself. Your hormones may be whatever, you may look whatever, but that does not define your self-worth, because it's the person you are. It's what you emit. So if you emit love, happiness, and positivity, then what your hormones are doing to you, what your body looks like, does not matter. Yes, it matters to a point where you want to change it for the better, but that starts with self-acceptance and a lot of self-love. So accept yourself the way you are. Start loving yourself for who you are rather than what you look like. And from there, work towards getting better, but not with self-hate.
Thank you, Ms. Neha. I actually thank you all for the very refreshing session. I'm sure it's going to inspire many, including me, to take a better care of our health. Thank you. Thank you so much.
Thank you very much.
Thank you.
Bye.
Bye.
Thanks, Muskan.
Thank you, ma'am.